Hi everyone, my name is Stacy Beck, and I'm going to be talking about my philosophy in healthcare and nursing. First, I'd like to tell you a little bit about myself though. I've been a nurse for over 15 years, and I worked the first 9 years in an inpatient care area, mostly with respiratory, medical, surgical, and ortho patients. I then moved into the outpatient setting, and I began working in a wound, ostomy, and foot care clinic. After that, I obtained my certification in those three areas through Emory University. I'm currently working in an outpatient clinic with wounds, ostomies, IV therapy, allergy patients, among other things. I'm currently in the process of starting up a foot care clinic there too. I'm married with one child, and we bought a 113-year-old house that we are in the process of fixing up. When I first became a nurse, I thought, oh no, how am I going to be caring and a compassionate person? I was not a touchy-feely person, and I could be shy and not open up until I got to know someone. In addition, being a new nurse meant that I was unsure of everything I did. Since that time and over the last 15 years, I have grown tremendously in many ways. I am definitely more opinionated. I am more sure of myself in situations in which I'm used to. I think I talk too much, and lastly, but most importantly, I have learned or acquired the ability to become caring and compassionate. As I have developed into a more seasoned nurse, I have determined that I am there to help the patient, and that is my job, plain and simple. Yes, I know that includes family, environment, and other things as well. I am a very strong believer in being a patient advocate. I try as much as I can to listen to what the patient is telling me, and then I fight for the patient to get what that person needs or wants. I will let the provider and other staff caring for the patient know what the patient's intentions are, and then I'll follow up with the patient to see if they were successful or not. There's a story that I have in which a patient had had surgery. The doctor came in at 5 p.m. right before going home and said to discharge that patient once she had voided. When I went in to examine her, the patient hadn't voided and was in pain and had nausea and vomiting. The doctor was notified of the situation, but he remained adamant that the patient go home even if it was at 10 p.m. I then notified the manager, who then intervened, and the patient was able to finally stay overnight. Another more recent story occurred when a patient did not want to wear an Una's boot, and this patient did say he would wear his ferro wrap. Typically, patients will wear an Una's boot until the wound is healed, but wanting to give this patient some control in his own care, I made a deal in which the patient could wear the ferro wrap, but if the wound did not get smaller by the next visit, we'd go back to wearing the Una's boot. This patient was agreeable to the plan of care because they were involved in the plan, and it was what they wanted. I also strongly believe in justice, which includes equality and fairness to all patients. I treat all of my patients the same no matter what their religion, race, sex, political views, gender identity, mental capacity, or anything else. I will admit there are trying times with needy patients, but then I take a step back from the situation. I take a deep breath and remember what the patient may have a reason for acting the way he is or she is. I then go on to figure out what that reason is by listening to the patient. Another part of this is respect. I respect all of my patients' feelings and anything related to their health care. Even if I do not agree with someone else's views or opinions, I keep my opinions to myself and then focus on that patient's needs. I've had some patients tell me that they were not treated well at other facilities, and I just mentioned to them that I always treat my patients the way I would want to be treated, or what my family member treated if they were in the hospital. We need to be true and honest with our patients about their health care. If we try to hide something, it may hurt them later, or they may become resentful that they found out about it another way. Not being honest or telling the whole truth is not helping the patient, and therefore it is not ethical. Education is one of my favorite things about nursing. I love empowering people with the knowledge they need to maintain a healthy life and prevent health issues from occurring. This happens a lot in the work I do pertaining to wounds, ostomy, and foot care, particularly diabetic foot care. You can't reinforce education enough in this population. Hopefully they learn from what I teach them and live a happy, healthy life. Everything I've said can pertain to ethics in some way or other. It is interesting that I said in my original introductory post that I did not have a lot of ethical dilemmas, but after reading our textbook and listening to our class videos, I have remembered some interesting stories related to ethics. One I already mentioned about pertaining to the person who could not void. I also had the ethical dilemma of a patient's family member coming up to me and asking me to turn the PCA up. I asked this family member if their loved one was in pain, but the family member said, "No, I just don't want this person to suffer." I then realized what this person was talking about, and I told them that I could only increase the PCA if the patient was in distress. Luckily, I avoided any further ethical problems pertaining to this because as I entered the room, the patient had already passed on. One thing that I found interesting is in the professional boundaries area. I think it's a little different in the outpatient area as I see patients multiple times, either daily, weekly, or monthly. I build a rapport and relationship with these people, and as I'm doing wound care, I converse with my patients about different things. If they bring up a story, it may remind me of a story of my own that I happen to bring up. And we're usually just chatting while I'm working, but I wonder if I have crossed the line before and will be more aware of this with patients in the future. I also have patients or family members that ask me, what is wrong with that person? I, of course, tell them that I cannot relay that information due to confidentiality. In conclusion, everything we do as nurses can be viewed as ethical or legal, or not ethical and illegal. Nurses are a special group of people because we multitask in everything we do. We are dealing with multiple patients and need to use our critical thinking skills to decide the best course of action with each and every one of our patients. We need to prioritize, decide which choice or decision is the best to make, while at the same time take into consideration the patient's lifestyle, views, and choices to come up with the best decision. It is rarely a linear decision because multiple obstacles come up, but in the end we work and communicate with our patients and be their patient advocate using care, compassion, justice, fairness, equality, respect, truth, honesty, and education to come up with the most ethical solution and give the patient the highest quality care available. Thank you for listening to my presentation, and I can't wait to meet you.